Let's chat now live to RACGP President Dr. Nicole Higgins. Hi there, Nicole. Thank you for coming on the show. So tell us what you're calling for. Why is this emphasis on more rebates for longer consultations?
Yeah, thanks, Lane. I think people don't realise that the Medicare rebate belongs to you. It's what you get back from the government once you've seen your GP or doctor, and it hasn't kept up with the cost of providing care. So we're calling on the government to increase the patient's rebate for longer consultations and for mental health consultations, things that people really need at the moment.
And what about longer term? How do you see the ageing population issue affecting, I guess, our health crisis?
Yeah, so people are getting older and more complex and spending longer with their GP and their teams. And we also know that one of the things that GPs see the most are mental health consultations. So we want to make sure that patients get the rebate that they deserve. And we know that funding drives outcomes. We have seen what happens when you invest in general practice. And that's what's happened with the tripling the bulk billing incentive, which has really slowed or stopped that decline, actually increased the rates in the areas that needed it the most.
Do you think health is a sexy enough issue for federal politics, though?
Yeah, so look, last year's budget was a shot in the arm and it helped, but health is an essential right, and we need to make sure that we invest in primary care, which is the foundations of our health system. We keep pouring more and more money into expensive hospitals, but prevention's better than cure. Let's put the money right at the start, keep people out of expensive hospitals, and make sure they stay in the community with their families and their supports.
So I'm reading, Nicole, the statistic that there'll be a shortage of 11,000 GPs by 2031. How will that affect the healthcare that we receive?
Yeah, so there's a shortage across the whole primary health sector, not just general practice. Our nurses, pharmacists, allied health as well. So we do all need to be working together, but we also need to make sure that we invest in the next generation of GPs. One of the biggest barriers for doctors working in the community is once you leave the hospital system, our GPs in training lose their paid parental leave, their other entitlements, and they take a significant income drop. So we just want to make sure that doctors in the community are on parity with hospital doctors to keep people out of hospital in the first place.
Do you think there are enough incentives to get people to study medicine, to become doctors?
Yeah, so the problem isn't that people aren't going into medicine. We've got more medical graduates than we ever have. But from when I trained, where 40% of the graduates became GPs, it's now around 14%. And that's because general practice has been undervalued and underfunded, especially over the last 10 years by successive governments. And it's now time to make sure we, as I said, invest in the foundations, put money into general practice and primary care, and keep people out of hospital in the first place.
And what sort of numbers are we seeing in training international doctors?
Yeah, so
that could be a ready solution.
Yeah. Our rural workforce, 52% of our rural workforce is reliant on doctors who trained overseas. We've got doctors who want to work in Australia and who are ready to go. The red tape's really tricky. The problem is, though, that the government stopped funding them in June last year. So these doctors now have to fund themselves to go and work in the places where we need them the most. So we would like to see these doctors supported and funded to go and work in our rural and regional communities and those of need.